all know that good oral hygiene and regular trips to the dentist can make for a great smile and, even more importantly, a healthy mouth. But if you're one of those people who avoids going to the dentist, or perhaps you have impacted teeth, or you're experiencing some type of mouth trauma, you know how painful that can be and how it can affect your health and even your whole life. These are conditions that most general dentists don't treat, in which case you might be very happy to meet the man we're visiting today. Hi, I'm Janice Marie, and we're here today in Commack, New York, at the office of Dr. David Miller. He's one of the area's most respected and successful oral and maxillofacial surgeons, and his patients say that his gentle touch and a lifetime of expertise will give you plenty of reasons to smile.
I'm an oral and maxillofacial surgeon, and what that means is we treat problems of the teeth and the mouth and the face. Usually we work in conjunction with a general dentist to help provide their patients with the work they need. A patient will go to their general dentist. The dentist will tell them that they have a problem with their teeth or there's something in their mouth that needs to be evaluated, and the dentist would refer the patient to see me. Then the patient would come to the office and we would evaluate the problem and discuss with them what needed to be done and take care of their problem. Basically, it's all a team, the dentist, the patient, and the oral surgeon, that we're working together to provide the best treatment, the best care for the patient.
There's a lot of people that don't like going to the dentist at all, and it often leads to these problems that they're experiencing. How are people feeling by the time they get to you, and how do you help them through that?
When patients come into my office, they know they're going to get a calm, relaxed experience. Now, I like to say I perform oral surgery with a gentle touch. I try to be very calm. We have a relaxed approach in the office. Most people say it's a very enjoyable experience, as much as any experience in an oral surgeon's office can be enjoyable. So the patients don't feel pressured. They don't feel stressed out any more than they already are. A lot of times the patients are extremely nervous and anxious, and we have ways to help them with that also. You know, we have available the nitrous oxide, which many people know as sweet air or a laughing gas, to help calm the patients down, and also we provide intravenous anesthesia if the patients want to be asleep for the procedure. And this makes it a lot more comfortable for them, knowing that they have these options that the oral surgeon can provide.
I'm a dental hygienist. I work in different offices, and I saw, especially in one of my offices, how they refer a lot of patients to come here for Dr. Miller to have their wisdom teeth, patients that need to have their wisdom teeth taken out, some implants. And then when patients came back after they had the procedure with him, they had a lovely experience. They were very happy. They were nervous, but when they came to Dr. Miller, they were happy. And myself, I needed to have some wisdom teeth taken out. So since I heard that a lot from these patients, I decided to come. I met the staff, I met Dr. Miller, and I decided to have my wisdom teeth taken out by him. He's very nice, very pleasant, and very calm. I was a little nervous, and he helped me. I had my 4 wisdom teeth taken out. The recovery was just as he told me it was going to be, no painful. And, I was very, very happy with the service, and everyone was just so nice with me.
The office staff is terrific. Dr. Miller, he explains thoroughly everything you need to know, and he doesn't push like some oral surgeons will do to get the implants done. And he basically leaves it up to you how you want to do it, and he suggests, and if you want to go along with what he suggests, then he's good with that. But he'll listen to your suggestions also. So I was very happy with Dr. Miller.
I understand you've been around the world of dentistry and oral surgery for a long time, and your father was also an oral surgeon, right?
My father was an oral surgeon, and he started this practice back in the 1960s. And as a child growing up, I would see, the work that he did. During high school and college, I would come into the office and assist, and I would just see the effect that he had on the patients. Again, the patients come in pain, they leave smiling and happy. And that was just something that I thought was amazing. So that led me to, to pursue dentistry as a career. And all through dental school, I always had in the back of my mind that I wanted to go into oral surgery also. And here I am.
I was a longtime patient of Dr. Miller. I originally started as a teenager with Dr. Miller's dad. Came a point in my life that I needed a lot of dental work, and I was afraid because of anxiety and fear. And I went to other dentists, and they all offered to do the work for me, but I couldn't bring myself to sit down in the chair. So what happened was I asked my mother if Dr. Miller was still practicing, and she said, I think the son might have taken over the practice. So I said, I'll give him a call and see what he can do for me. So I called up on the phone, and I said, the first thing I said to her was, do you still knock people out? And she said, yes, we still knock people out. And I said, okay, I'm going to make an appointment. And I came in. I spoke with Dr. Miller. He was great. He went over all my options. When I say it's been 8 years waiting, it's been 8 years waiting. It was the best decision of my life. I came in, I asked him, he gave me the medicine. I think I said to him, how long is it going to take? I woke up, I was done. I was like, this is unbelievable. I had absolutely no swelling, no pain. I thought I was going to lose weight, but unfortunately, I didn't, because I was able to eat very well, and it was incredible. I can't thank this office enough for what they did for me. It was wonderful.
Outside of the office, I like to give back to my community. I feel it's important to remember where you came from, to remember and to help the people who help you. As part of that, I volunteer at Stony Brook Dental School, where I went to school. I work in the oral surgery clinic with the students, helping them and assisting them in oral surgery. Additionally, I'm a member of the Rotary Club in Commack. Rotary is an organization of business and professional people who try to help the communities in which they live. The Rotary Club also sponsors blood drives, which I have been the chairman of in the past. I've been president of the Rotary Club. Currently, I'm the treasurer, and it's a way of giving back to the community to help them out because that's where I get my support from.
We were referred to Dr. Miller. I brought her in the first time for a consultation, and he was wonderful. He explained everything to her, took pictures, let her see the bottom wisdom teeth, showed her exactly what would happen if they weren't extracted, and just was calm and explained everything perfectly. I have, nothing but the highest praise.
Your oral health is important, and a healthy mouth makes for a happier life. So give Dr. David Miller a call. Reporting from Long Island, I'm Janice Marie.